Hello everyone, Dr. Simon Clark here, Director of Ridgeway Health and Wellness, and welcome to my short video today on sleeping postures. Something that I get asked day in, day out by my patients, and something that's very important, not just for existing back problems, but back posture can actually cause back problems as well. I want you to understand the mechanics of the back problem so you can understand how detrimental it can be as well. So I'm going to go through the spine so you can understand the best posture of the spine and how it's actually curved. We've got three natural curves. In the neck or the cervical spine, the curve goes inwards, and that's exactly the same as the lower back or the lumbar spine. That's called a lordosis, and we should be approximately 42 degrees there. In the center, we have a kyphosis. That's the thoracic spine or the mid-back area. And when we're sitting or lying in prolonged postures, we should try and maintain those curves. Right, the first one, the one I try and outlaw and try and get my patients out of, is quite habitual with low back pain sufferers and chronic neck pain and headache sufferers as well. So we're going to show you why this is so bad. There's two main reasons. So I'm going to pop the spine on the front. Now if you were sleeping in that posture, what we've got to remember, underneath the lumbar spine we have the abdominal cavity and the stomach. And because of that, what happens, we end up flattening the lumbar spine. So we lose that curvature and that lordosis in the spine. And that puts a lot of pressure on the nerves, creates a lot of inflammation, and also stretches the muscles and ligaments in that area. So you become more susceptible to injury. The second reason is the neck. Now when you're lying in that posture, you can't lie face down because you won't be able to breathe. So you'd actually rotate the neck into that kind of posture. Now, I ask anyone to sit in a chair, turn their neck and apply pressure for 1, 2, maybe 3 hours at a time. And you then understand how sore the neck would be. Okay? So that's the posture we need to get you guys out of. The best posture. So we go back to our perfect curves. We have our lordosis in the lower back and the neck, and the kyphosis in the upper back, or the mid-back and thoracic spine. And the best posture is actually in the fetal position. The reason that's so good is because we can maintain perfect curvature of the spine. What you do in that position is actually bring the knees up. And if you do have back pain, what I suggest you put a pillow in between the knees, and it keeps the hips equidistant apart. With the pillow, it's not the amount of pillows you have, it's the distance between the bed and the head. And if you have too many, you're going to push the neck too far over one way, so you're going to stress the neck. If you've got one real flat pillow, the head's going to fall onto the bed. So again, you're going to compress the neck and cause a bit of neck pain there as well. So make sure you maintain the pillows for that distance between the bed and the head. So that's the best sleeping posture. And now I'm going to talk to you about lying on the back, because you can lie on the back in one good way and one not so good way. So if we pop the spine on the back, again, trying to maintain those perfect curves. Now if we straighten the legs in that position, what ends up happening, we rotate the pelvis. And when we rotate the pelvis, we end up flattening that back, and again we lose that lordosis of the spine. The best way is actually bending the knees, and if you bend the knees, we rotate the pelvis in the correct posture and we create the correct curve in the lower back. And the best way to do that or maintain that position is put a couple of pillows underneath the knees. And then with the pillow, it shouldn't be too big, just one medium firm pillow is enough so we can maintain the actual neck curve as well. Okay? So incredibly important stuff. The reason it's so important, and one thing you must take away from this, is remember your spinal cord and nerves control every cell, tissue, organ in your body. And when we lose these curves, we actually stretch that spinal cord. So it can be detrimental to your health if we don't maintain these correct postures. I hope this helped, guys. Please give it a try, and I look forward to seeing you next time. Take care.